And thank you for watching today's show. I am, of course, joined by the very special Dr. Robyn Thompson. And today we are going to discuss breastfeeding after breast surgery. We have had so many questions as of recent, and I think it's quite a big topic at the moment in other forums as well. So we are going to share with you what Dr. Robyn Thompson understands about breast surgery and about breastfeeding as well. Thank you for joining us today, Dr. Robyn. How are you? Tired, I'm sure, after another busy day.
Yeah, full day today. Thank you. Yeah, I'm okay. Bit of old age backache, but at the screen all the time. But excuse me for scratching my eye. Yeah, so I'm fine. Thank you.
Good. And obviously, we are very excited about sharing a little bit of your expertise with these lovely ladies watching today. So if you are pregnant, from us both, a huge congratulations. And we're really glad that you're here and you're looking to learn more. So I shall get my questions ready. So Robyn, what have you been up to today? Have you had anything exciting on?
Oh, yes, I have been busy all day. Yes, with beautiful women, with students of the Academy. We've been talking with the students of the Academy, with beautiful women, and some sad stories too.
Yes, unfortunately, that is part of the role here in the Thompson Method, but we can take comfort in knowing that we are improving things. You are improving things. Okay.
We're trying. We are
We're
working
trying.
towards. Yeah, we're trying to make sure that women are encouraged and women are not defeated or coerced or going through things that other people think they should do. So we're trying hard.
It's certainly an uphill battle sometimes, isn't it?
Yeah.
Okay, so one of those topics that women are often coerced around and have a lot of fear around is breastfeeding and breast surgery. So I think it's really good that we are going to follow suit and discuss this topic. So Dr. Robyn, I wanted to start first of all with if someone watching has had a previous breast surgery, should they give up on the idea of breastfeeding?
No, not without, at least from my perspective of having a detailed history and talking with and listening to the woman who's, looking at this. In my experience, the women have had good success at breastfeeding when they've been told previously they'll never breastfeed or, it's going to be very difficult. So I think from my perspective, I like to give them the best possible chance to try to test their pituitary gland, their breast with their baby and see how their milk production is working and also to encourage them to still continue with the 3 golden hours, to be aware of what happens over the first 72 hours, that milk's not in the breasts aren't full then, and to be aware of all that in advance so that they're not put off by others maybe saying, this won't happen. Also, it's quite good to talk with the women about the type of surgery they had. So that helps me understand a little bit more too, and being able to explain some things with them. And of course, they're all unique. Every person on the planet is unique, and their breasts are unique, their nipples are unique, their bodies are unique. It's all genetically unique and biophysiologically unique. So we don't give up easy like that. We work with the woman so that she has the best possible opportunity to do what she needs to do.
Mm-hmm. And one of the most common questions we get is surrounding breast implants from previous times, maybe even recent times. And women just are very, very passionate about breastfeeding. And they have asked, is it safe for me to breastfeed my baby with silicone implants? What do you think?
Well, I imagine, I'm imagining now that question comes from the history of some implants leaking. So it depends where the implants are. I think there's been a change in the type of implants too. And I'm not the specialist at this, but again, I think that may be where the fear comes, or the fear may be that if they've had surgery that has interrupted the ductal networks, for example, or removed the areola and that's been stitched back, that might have changed the ductal network to the nipple. That could have an influence, but it doesn't mean to say that the whole breast is going to be like that. So there might be part of the breast that's not functioning as well, but it depends where the implant goes. And obviously now I think the surgeons are actually using different types of implants because of that episodes they had with leaking silicone implants. Yes,
which was such a big shame for the medical industry.
yeah, yeah,
Hopefully, many women that did go through that have had that issue resolved now.
yes,
So
yes.
I guess what you're
And that's
saying
not
is,
an issue that's not painful too, because they have to go through another process. So it's difficult for those women to have to face those things too. And we need to be gentle on the journey that we do take with them. Yeah.
yes, absolutely. And if it is your desire to breastfeed and that has been your experience or something similar, what we want to say and we want to reassure you is that there are many women in our community that are successfully breastfeeding,
Yes.
following
And
similar situations as your own.
they're probably mainly, and I don't have the statistics all analysed for that, but there are statistics.
That's the researcher in you.
That's right. Don't have time for that at the moment. But it's if the implants are behind the pectoral muscle, if they're placed behind the pectoral muscle, then the forward part of the glandular tissue is generally in the breast, and the networks, the ductal networks down to the nipple ducts, haven't been interfered with, and quite often that's very successful. However, what does happen there that I have found, and I'm not sure that happens with every single person, is that because now the implant has taken up part of where the breast would, as it was filling, would move backwards. It actually has to move forward and stretch to take the volume, especially around the the 72, 96 hours when the milk volume is peaking after the birth. And then also with women who maybe, whoa.
Oh,
That's my insects.
oh, I thought something fell down. I forget about the Aussie beasts. Just a bit.
Sets off my startle reflex all the time.
Oh, I'm glad it wasn't me. I would have jumped way higher and louder than that.
It's a real blessing because I'm not bitten by the insects while I'm sleeping at night now.
Oh gosh, I'd love the heat in Australia. For those watching in Australia, I'm not sure I can handle the bugs though. I'm a bit of a wuss.
I've tried so hard not to react.
No, you did very well.
It's a spontaneous reaction.
There you go. A bit of free comedy for our viewers.
Yeah. So anyway, yes. So that's what I find does happen for the women that have had their implants behind the muscle. And I don't know. What I don't know is how many women who are intending to have implants have been informed about their years that they may breastfeed.
I wonder if that's something we could suggest, that maybe women ask and say that they do plan to breastfeed in the future.
Yeah, has there been any discussion about that? And then the surgeon that's actually doing the procedure will know, because they're actually looking inside the breast. So that would be, they're knowing what they're doing. But definitely I have seen even some women that have had the areola removed and replaced, they've been able to breastfeed.
Yeah,
now,
and that's one of the big questions, I think. Sometimes women are told before they've even tried that if a certain part of the breast is touched during surgery, they won't be able to breastfeed.
I just want to make it clear, I'm not saying that everybody can do that. And sometimes some women might partially breastfeed and then have to feed their baby something else, whether it's, maternal milk, or whether it's, milk off, that they purchase. I don't know. But that may be a necessity for some women, but it does still keep their baby with them at their breast. That part of that is, the unique woman, the unique breast.
And like you said previously, understanding and implementing those 3 golden hours is really key, even for women who haven't had breast surgery, because that gives you the best possible start to breastfeeding. So I'm glad you mentioned that. So does previous breast surgery cause low supply? Now, this is such a high-ranged question. It's hard to answer really simply. I guess you have already answered it. Do you want to touch anything else on that?
Low milk. I talk about low milk volume. So again, a lot of what we're finding, that's Rachel and I particularly are finding, is that when the milk volume is it's hard to make a statement that that they have low volume, but what happens is as the milk volume that was high starts to regulate, or if they've been expressing a lot and they've had high volume, to regulate it back, there's often a fear that I have low milk volume, rather than that the milk volume is regulating, and the baby also regulates the milk volume, feeding, it depends what age group they are, how many times they're feeding a day, and if they're having foods, that's the older baby. But the newborn and young baby, roughly with a little stomach the size of a closed fist, the baby's closed fist, is meeting its needs by averaging about 7 feeds in 24 hours. That's feeding from both breasts each feed.
So Robyn, would you agree that
Sorry,
no, it's okay. I think we're crossing over anyway. I think what I wanted to ask you was, would you agree that actually the majority of women who have that feeling, that worry that they have not got enough milk for their precious babies, is actually fear, and sometimes, a lot of the time, it's because they've been suggested it by someone else, and maybe they've even had an interruption in that milk production process at the beginning and have had top-ups suggested, or they've been told to express to increase milk volume, and that's created some other breastfeeding complications also.
Yeah, or they've had opioids during their labour as well. That makes the sleepy baby. So that makes it a bit difficult to the starting point, from the starting point. That still doesn't mean to say they can't breastfeed.
No, absolutely.
And with low volume, no, I don't think they would have low volume unless the anterior breast has been changed. And so if the glandular tissue has been changed, where the milk is mostly stored back here, I mean, it is stored in the front too, but it's when the breast is full, that's you can see full to being what it is for the baby, but the baby regulates the milk volume for its growth and its plateaus, and its growth and its plateaus, and they do that till they're 17.
Very magical stuff. I remember talking with you about that when Jacob was around 12 weeks, and I had a moment of panic, and after just a little bit of reassurance and a little bit of guidance, I did feel much better. But of course we do worry, don't we? It's part of who we are now as mums. We just constantly worry about everything.
So Chelsea, have I answered that question?
Yes, you absolutely have. And I guess there's more than one answer, because it does completely depend on the unique circumstances. Right. But no, low milk volume is not necessarily something that's linked to breast surgery. There's so many more factors that come into play.
There's other factors too. Yeah. And certainly, I haven't found it as much, but then I suppose I have the added advantage of being with women one-on-one, and my team that works, we do that one-on-one, and we're focused just on that woman. We're not looking after a whole group of women, and that does make us listen. It makes us observe, and we're more informed about that unique woman, her body, her baby. It's really important.
And I think that from my own statistics, I guess, from being involved in the community, I've found that a lot of women that have the privilege of finding the Thompson method, no reaction there, another bug one. I think those that have the privilege of discovering the Thompson method during pregnancy, those who have gone through the materials and have that preparation, of course, the support in the club as well from the team, they are a lot less likely to need that one-on-one to support, because they have that confidence to trust in their body. They have that understanding to make informed decisions. And then, of course, if they have any niggling questions along the way, they can pop up and ask those. So I think it's important just to say that, we're here, we're ready, we're waiting for you, and we have everything you need to give yourself the very best start to breastfeeding. Dr. Robyn's brain is incredible. She has the unique,
especially when the zapper's going off.
She has the unique perspective of both hospital working alongside women, birthing babies, and in her private practice birthing at home as well. So, so much experience. Robyn, how long have you worked alongside women for?
Well, if I go back to my nursing days, because women were involved in that too, but my nursing days, 61 years in the Australian health system, and as a midwife, 50 years. So,
and you are incredible. She's too humble, our Dr. Robyn.
No, I'm not incredible. I just love what I do. And I'm very blessed for the people who guided me on my journey. So even in my nursing career, I was guided by people who were so good at helping me through the journey, advising me what I might do and what I might not do, and what I'd like to do. And then as a midwife, I was very blessed by the beautiful Verna Rodder, who is no longer with us now, who placed me in charge of a public hospital labour ward 3 months after I had finished my midwifery. Midwifery education, yeah. And I'd had minimal experience except for my own babies, but you can't apply that to anybody else because I'm unique too.
I think that's testament for how incredible you are, though. There must have been something special she saw in you back then.
Well, she was the beginning of this journey that I'm on now. She was the beginning, and then I bumped into my 3 professors.
The very famous 3 professors. If you want to know more about this story, we have covered it, Dr. Robyn and I, in a bit more detail, and it is very fascinating. It's very, very, very fascinating.
Yeah. They've been
all happened by chance, you claim, don't you, Rob?
Yeah, it did. That's my life. I, as I would say, probably normally I go by the seat of my pants. I just slide.
I love it. I love it. It's very.
I love the continuing learning. I'm always learning. I love to be able to sit and talk with women, not dominate them. I love that part of it. I love listening to what they have to say. I never ever make other than suggestions, because their instincts are always right.
That's so if I listen, I felt that myself.
Yeah, if I listen carefully, they already know, and all I have to do is encourage them on their journey and provide the information that helps them understand it a bit more.
Very true. And we hope that many more professionals do implement this guidance, this loving guidance, rather than this domineering coercion that is sadly often seen.
Gentle, calm, and nurturing.
That's right. I remember you said to me once that you want to nurture women so that they can nurture their babies however they choose to. And it's a very important quote from you, I think.
Yeah, however they choose to. Yeah, there's another little one flying around in front of me now. I don't know.
You're being haunted now. Who is that? Who is that bug in reincarnation, huh? So I have a final question for you. And this one, it may be a bit more difficult to ask, but I suppose we can generalize. So mastectomy. Is it possible to breastfeed following mastectomy? Is it possible to breastfeed with one breast?
I've had experience with women who have only been able to feed from one breast, but both of them had congenital abnormality of one breast. So congenital abnormality is not a very nice word, but one of them had not developed one breast. The other one had a breast that had 2 nipples, not a central nipple, one above and one below where the areola roughly would be, and was unable to feed. The baby was unable to feed, but we did try. And so they both breastfed successfully. The beautiful woman with one breast fed her babies till 2 years. She's fed 4 babies till 2 years.
Wow.
And she just introduced food a little bit earlier. And they did beautiful, beautiful. So I think she's written a book on that too. So I have worked with women who've had mastectomy who wanted to have their babies on their body. So we set up a feeding line for them, or one that was beside them rather than around their neck.
Yeah.
And they were able to offer, short sessions of feeding that way, just the sensation of their baby being with them. Yeah. And the baby, it's difficult. There's no saying that it's not, but it's also about listening to the woman and what she needs. What is it that she needs to help her along her way? And
of course, breastfeeding is, for many in their journeys, way more than being able to provide milk from your breasts. It can be the skin-to-skin bond. It can be so many more things than that. So I think that was very important to cover. And we recently heard a very positive story about a woman who had mastectomy removal of one breast, and she was able to breastfeed for 3 years on the singular breast. I think she said it was the right breast. And
Yes.
we were very proud of her. So that was very lovely to hear. With the right
Yes.
preparation and support, she was
Yes.
able to do that.
And I learned that I was encouraged by those women way back when they were feeding too, and they used one breast all of that time. I'm very proud of them, but also I was learning from them as well. You know, it wasn't something that I knew a lot about, but I was learning. So I'm forever grateful and very privileged to have worked with as many women as I have over the years who have magic stories to tell, you know, in their own unique way.
And there are so many stories. Like, I think magical is the perfect way, and it is
Mm.
so uplifting because, of course, we do hear some sad stories too. So these ones
Of
do
course.
help
Yeah.
balance out, don't they?
Yes.
So I think
Yes.
that the few points that I want to alliterate from today's show is that every body, woman and baby and breast is so completely unique. It's hard to answer whether it's going to be possible for you to breastfeed or not. But please take reassurance in knowing that there are many, many women, those bugs, there are many women in our community that are successfully breastfeeding, following breast surgery, implants, augmentation, many, many different surgeries. So
Yes.
reach out, connect with us. We'll hopefully chat and discuss this a bit further. But like Dr. Robyn said, give yourself the best possible chance of breastfeeding. You have to try. You have to give it a try. Don't feel coerced or have any fear put on you before you've given yourself a go. And
Yeah.
congratulations to you on your pregnancy. Robyn, what would you like to add?
What would I like to add? Well,
Yeah.
I'd like to add that, you know, if there is anybody who needs some encouragement, then, you know, the people on my team are very, very skilled at that. They've had babies themselves as well. So that I think that even though it's not the same, it's internalised a lot for them, the situations, not necessarily, you know, where there's a breast you know, implant or a breast augmentation or a breast reduction, it's going to be unique for every particular woman.
Mm.
And I think as long as we sit and talk and we give them the best possible opportunity to do what they need to do and give it their best try, I think that's what we need to do. And they work it out themselves, but we don't leave them until they're happily on their way doing what they need to do.
Yeah, for sure. I think that little bit of encouragement just goes a very long way, and having a very gentle, guided community behind you as well can make all the difference.
And a very supportive network as well. Women are supporting and networking with each other, which I think is brilliant because
Yeah.
that doesn't happen like it used to happen in the days gone by. You know,
No, especially now that you have launched your wonderful academy, there's a
yeah,
whole new influx of soon to be certified Thompson Method
yeah,
educators, practitioners, and we're all sharing that knowledge that we've gained. And it's so wonderful to be able to take
yeah.
that into the community is
And we
definitely
meet
going
with
to
them.
be a different.
Yeah, and we meet with them every week, and they're asking some amazing questions. So it's always incredible to know that, you know, this is a possibility over time for more and more women to be able to breastfeed and support each other as well.
Yes, absolutely. There we go. Do you want to learn more about those 3 golden hours that we've discussed? That very special and important first breastfeed and those first 72 to 96 hours. Do you want to learn more about everything that you need in preparation before your journey begins? And would you like to be fully prepared for breastfeeding, whether you have or haven't had breast surgery previously? Are you feeling a little bit nervous? Because I know I certainly was. And you just need that little extra guidance. Get in touch. I'm going to pop the link down below for our Facebook group that I encourage you to join so that you can discover more about the Thompson Method and familiarise yourself with Dr. Robyn herself. We've got so much to share with you guys and we really love connecting with you. So reach out. And once again, from us both, congratulations on your pregnancy. We're going to be back here next Wednesday to discuss another interesting topic. So keep your eyes out. Thanks a lot. Thanks, Robyn. Thank you so much.
Thank you, Chelsea. You're a pal. See you.